Amoxicillin is a penicillin derivative used for the treatment of infections caused by gram-positive bacteria, in particular streptococcal bacteria causing upper respiratory tract infections. In this video, let's find found. What is amoxicillin? What is amoxicillin used for? Contraindication. What are the side effects of taking amoxicillin? How does amoxicillin work? How to use amoxicillin? What is amoxicillin? Amoxicillin is a lincosamide antibiotic that comes from the actinomycete Streptomyces linconensis. A related compound, clindamycin, is derived from amoxicillin by using thionyl chloride to replace the 7-hydroxy group with a chlorine atom with inversion of chirality. It was released for medical use in September 1964. Amoxicillin was discovered in 1958 and came into medical use in 1972. Amoxil was approved for medical use in the United States in 1974, and in the United Kingdom in 1977. It is on the WHO, World Health Organization's list of essential medicines. It is one of the most commonly prescribed antibiotics in children. Amoxicillin is available as a generic medication. In 2020, it was the 40th most commonly prescribed medication in the United States, with more than 15 million prescriptions. What is amoxicillin used for? Amoxicillin alone is indicated to treat susceptible bacterial infections of the ear, nose, throat, genitourinary tract, skin structure, and lower respiratory tract. Amoxicillin is given with clavulanic acid to treat acute bacterial sinusitis, community-acquired pneumonia, lower respiratory tract infections, acute bacterial otitis media, skin and skin structure infections, and urinary tract infections. Amoxicillin is given with omeprazole in the treatment of Helicobacter pylori, H. pylori, infection. Amoxicillin is used in combination with vonoprazan and clarithromycin as co-packaged triple therapy or in combination with vonoprazan as co-packaged dual therapy to treat H. pylori infection in adults. Contraindication. Any previous anaphylactic or serious skin reaction, for example, Stevens-Johnson syndrome, to amoxicillin or any other beta-lactam is a contraindication to amoxicillin. These reactions may have crossover sensitivity with cephalosporins or carbapenems. Side effects. Common adverse drug reactions associated with systemic amoxicillin therapy: nausea, vomiting, diarrhea, changes in taste, headache. Pharmacodynamic. Amoxicillin competitively inhibits penicillin binding proteins, leading to upregulation of autolytic enzymes and inhibition of cell wall synthesis. Amoxicillin has a long duration of action as it is usually given twice daily. Amoxicillin has a wide therapeutic range as mild overdoses are not associated with significant toxicity. Patients should be counseled regarding the risk of anaphylaxis, Clostridium difficile infections, and bacterial resistance. Mechanism of action. Amoxicillin competitively inhibits penicillin binding protein 1 and other high molecular weight penicillin binding proteins. Penicillin bind proteins are responsible for glycosyltransferase and transpeptidase reactions that lead to cross-linking of D-alanine and D-aspartic acid in bacterial cell walls. Without the action of penicillin binding proteins, bacteria upregulate autolytic enzymes and are unable to build and repair the cell wall, leading to bactericidal action. Half-life. The half-life of amoxicillin is 61.3 minutes. Dose. Ear, nose, and throat infections. Mild to moderate infections. 500 mg POQ12HR or 250 mg POQ8HR for 10 to 14 days. Severe infections. 875 mg POQ12HR or 500 mg POQ8HR for 10 to 14 days. Genitourinary tract infections. Mild to moderate infections. 500 mg POQ-12HR or 250 mg POQ-8HR. Severe infections. 875 mg POQ-12HR or 500 mg POQ-8HR. Spectrum of action. E. coli, P. mirabilis, or E. faecalis. Skin and skin structure infections. Mild to moderate infections. 500 mg POQ-12HR or 250 mg POQ-8HR. Severe infections. 875 mg POQ-12HR or 500 mg POQ-8HR. Lower respiratory tract infections. 875 mg POQ-12HR or 500 mg POQ-8HR for 10 to 14 days. Helicobacter pylori. H. pylori infection and active or 1-year history of duodenal ulcer. Triple therapy. 1G POQ-12HR for 14 days with lansoprazole, 30 mg, and clarithromycin, 500 mg. Dual therapy. 1G POQ-8HR for 14 days with lansoprazole, 30 mg, in patients intolerant of or resistant to clarithromycin. Anthrax. Post-exposure inhalational prophylaxis. 500 mg POQ-8HR. Infective endocarditis. Prophylaxis. 2GPO 30 to 60 minutes before procedure. Lyme disease, off-label. Erythema migrans and other symptoms of early dissemination. 500 mg POQ-8HR, depending on size of patient, for 3-4 week. 50 mg per kilogram per day Q8HR in divided doses, maximum 500 mg per dose. Chlamydial infection in pregnant women, off-label. First trimester, 500 mg POQ-8HR for 7 days. Safety advice. Amoxicillin is assigned to pregnancy category B. Animal reproduction studies have failed to demonstrate a risk to the fetus, and there are no adequate and well-controlled studies in pregnant women by the U.S. Food and Drug Administration, FDA. That's all the information about amoxicillin we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.